Hello, good afternoon. It's Alexa here with Kelowna Now. I'm sitting down with Steven Hopp, manager, owner, and pharmacist at Rutland Medical Pharmacy. We do a monthly column together and we share some insight on what's happening. We've talked about some vaccinations, we've talked about the flu. We're actually back here to talk about cold and flu season because we were starting to head into it last month, but you're really seeing the live data of people coming in and seeing you. So maybe let's start off. How is this flu season so far? I've actually been lucky, and I don't know that many people that have been that sick this year, but is this a nasty one?
Yeah, there's definitely been cases of flu, cases of COVID going around. It hasn't, there's not a huge, robust amount of statistics yet about, hey, it's a worse year, it's a better year. But so it's definitely going around. I think the uptake of the flu vaccine has been pretty good from what I've seen. So that's going a long way, I think, to prevent, a mass amount of spread of it. But every year there's a period where we see a bad stretch of people getting sick and complications, maybe especially for people that are more vulnerable. So it's always there. The weather's getting a little colder. It's been nice, but as the weather gets colder, we tend to be stuck inside a little bit more, and you're close to people inside more. We're a couple months into school now, so that creates the spread of viruses with all the kids in tight quarters. So yeah, everything comes into play, and certainly that's where vaccines can go a long way.
Is there a time period so you've obviously started seeing people and giving them the flu shot? Is there like does it go till December, or like a certain day
when we vaccinate,
or like when it's like over? Like you don't vaccinate anymore after a
Yeah,
certain season?
there are people that get their flu vaccines right into the following spring.
Okay.
So it's not that you're not eligible to get them later. Generally, any remaining supply, the date varies depending on which particular vaccine, but generally around June, if there is a little bit of supply out there, it expires, and then it gets destroyed, returned to basically the Center for Disease Control and the government, or to the health unit. But we see the bulk of vaccinating done in October and November, because that's when the flu virus really starts to spread. People, as I mentioned before, in the summer, the opposite, people are out and about and not generally as many people in close quarters inside, and so the spread isn't as bad during that period of time. But there is flu around 12 months of the year. It's just minimized due to activities and what's going on with people.
Um, is there an option for someone out there that is really scared of needles or has children and they just you want to get them vaccinated, or you want to get yourself vaccinated, but you're deadly afraid?
Yeah.
Like you might have to medicate them before they go or something.
Absolutely. And there's different things. There can be just strategies. If I know for us in Rutland Medical Pharmacy, we'll spend the time with people to be patient with them and give them time. I've had parents with kids where the kids are really freaking out, for lack of a better term, and it's more the anticipation of the needle. The needle itself you barely feel, but it's understandable. The idea of being stuck with something sharp is scary. And so, we try to be patient and give people time. I've actually a couple times vaccinated a kid's stuffed animal for them first to make them feel
cute.
better. Not with the actual vaccine, but, go through the process and makes the kids feel better. So you do what you can. But I mean, if all else fails, or if you just request it, we don't have to go through the trauma of all of that first. There is actually what's called a live attenuated influenza vaccine in the form of a nasal spray. So it's the tiniest little puff. There's no needle involved. Tiny little puff in one nostril, tiny little puff in the other nostril. It is live, whereas most other vaccines are not a live vaccine. So theoretically, a live vaccine you would think would cause an infection. even though that is a theoretical case, there's not really any evidence that anyone who gets this nasal spray, because the virus is weakened, even though it's live, there's no evidence of someone actually getting a flu infection from it. Sometimes there's a bit of a runny nose and sort of mild nasal symptoms, but the way the virus is treated, despite being live, it's cold treated, and it seems to just stay in the nasal passage. And by colonizing the nasal passage for a short period of time, the body still is exposed to it and can still create antibodies similar to when you get an injection into the bloodstream. There's also a small theoretical case of someone maybe shedding some live viruses. We don't really have any evidence of people getting sick from it, although that would be hard to track. But so occasionally they would say if the person getting the nasal spray is going to be around people that are really vulnerable, say someone that's going through leukemia or cancer treatment, it might be best for them to avoid contact with people like that. But there's still, there are options, definitely. And then, I mean, side effects. Sometimes people have a reaction due to usually anxiety from vaccinations, of feeling faint afterwards. Not all pharmacies would have the facility, but we're fortunate to be in a doctor's office. I have a few people that come to us just so they can lie down.
Yeah,
they're
that's
much more
huge.
comfortable. We can borrow one of the doctor's exam rooms. You lie down on the bed. We give the vaccine that way. You can take a few minutes till you're good, and then you can be on your way. So different places can provide what you need if there's vaccine anxiety there.
Well, yeah, and everyone's different. Sometimes you just like, I think everyone personally knows you're either like, it's like giving blood or something. You know that you're good at it, or you know you're not good at it.
Absolutely.
So having that option to lie down, or taking the extra time to really care for young kids or elders or someone that has anxiety. What is this flu, the symptoms that you're hearing? Is it like a typical flu like everyone's having? So you're like sweating, like diarrhea, vomiting, like
it has been quite typical. The gastrointestinal symptoms like diarrhea and vomiting are actually not common with flu viruses. We like to say that there's no such thing as a stomach flu, because usually when a virus causes those gastrointestinal symptoms like nausea, vomiting, diarrhea, it's actually a completely different type of virus than a flu virus. In rare cases, you will see the flu virus affect some of the tissues in the GI system, but it's not typical. Your typical symptoms, which is what we're seeing this year, would be certainly chills, fever, sore throat, aches. That's where the flu virus infection usually starts. Sometimes they do move into typical cold symptoms, the stuffy runny nose. So the idea, which you sometimes hear, that a flu doesn't cause a stuffy runny nose, a cold does. Cold doesn't cause fever. The flu does. It doesn't always work that way. There can be some crossover on the cold and the flu symptoms. And then complications with flus and colds can be different as well. I would say the complications due to flu viruses are likely to be a little worse than with a cold, especially for vulnerable populations. That's where the risk comes in. Maybe even turning into pneumonia symptoms, pneumonia infection in worst case scenario.
You said that you've been having, or people have also been getting COVID again, or having COVID. Are people testing again? Like, do you recommend, do you think, taking COVID tests? Like, how do you know if it's COVID versus the flu, or is it kind of all just...
It's hard because COVID symptoms can really vary.
Yeah.
There's still lots of people who get COVID that don't really get that sick. Then there are people that get quite severely sick or have long COVID symptoms, neurological symptoms, stuff like that. And there used to be test kits everywhere. Every pharmacy had them. They were free. They were provided by the government. I mean, I can only speculate, but I'm sure that's a huge cost for the government, and there's not free COVID kits being distributed in the same way. I know we certainly haven't been able to get any through the normal channels. So as a result of that, in general, people aren't really testing. I believe the hospital can still test, but I don't work there. So if anyone who works at the hospital is hearing this and saying, no, you're wrong, then I apologize. Well, you wouldn't go there just to test anyway. I do. Someone who works for me was actually in Save On Foods not that long ago, and they saw test kits to purchase at Save On. Again, if you're out of them at Save On, I apologize. But so you might find them. The message there is you might find some to purchase here and there if you did want to test, if that was something that interested you. I mean, COVID, like any virus, if you feel that you're sick, if you're concerned about passing it on to people, really the procedure for a cold or a flu would be the same: to isolate for a few days until the symptoms are resolved for the most part. You're generally most contagious about a day before you start to show the symptoms. That's the tough period where you're not going to know. And then the first few days of the symptoms, you're most contagious. You can still be contagious as long as you have, stuffy, runny nose, cough. But it's the first few days, because especially with respiratory illnesses, sometimes you are over it, but you have a little bit of inflammation that's kind of just staying there for a while. It takes the body to get over that, and that's why sometimes we have that nagging cough, even though we usually will get over flu symptoms in 7 to 10 days if we're healthy people.
What is a concern? Let's say I have the flu or cold symptoms and I'm like, I don't know, let's say I'm 3 weeks in. Like, should I be more worried and go see a doctor and maybe I have an infection? Or like, when do you start to when's the kind of gray area where you're like, okay, this can't be just a flu?
I would say anything out of the ordinary. So 3-4 weeks of symptoms, although it can happen. I mean, there were some cases last year's flu season where people were having symptoms for 6 weeks or so before they got over them. It is atypical, so out of the ordinary. So if something's going on that's out of the ordinary, certainly it's worth getting a medical opinion on it, seeing the doctor. You can always phone and talk to your pharmacist. The doctor is going to be a little bit better at certain things because they can listen to your chest and make sure something hasn't moved to your chest. But if you just want to say, hey, these are my symptoms, is this normal? Most of us as pharmacists can probably at least help you and give you some advice as to whether or not you do need to see a doctor with that. Certainly if it's moving deeper in the chest. So a typical cold or a flu, although it can cause a yucky cough with stuff coming up, you'll get over the worst of that quickly, and it won't just stay in the chest and cause that deep, hacking, croupy pneumonia situation, which is what we really want. So if you're feeling severe symptoms, really tired, fever that you can't control, certainly with some Tylenol or ibuprofen, it might be time to get some medical attention.
I would say a fever is a big one, right? That's one that can get really scary.
Especially if you can't control it. Fevers, especially in kids, kids' bodies will go into a situation of fever much easier than adults. But I mean, if you have a young child and a fever is going up to 104 and you can't get it down right away, that's time to get medical attention. Even 102, although it's high, but if you're bringing it down, in a reasonable period of time with some cool bath and Tylenol, then usually the hospital would say, we're okay here. Even with 102, if you can't bring it down in a reasonable period of time, that something else is going on. Why is this fever happening? And we used to say things like, oh no, a fever's good, it kills the virus, and it does. But a sustained fever can do damage to a person, to parts of our body too. So we never want that.
Okay, well, let's talk about, we kind of talked a little bit about it last time, but how can people, make sure they're being extra safe during this time of year? What are some tips that you would give someone out there that you're like, okay, you want to try and not get sick, you need to do this?
Well, and you're right. We talked about it last time, but I think it's great to review things like this and maybe somebody didn't watch us last
Yeah.
time, right? So you have to tune in to get all the details every time, but certainly hand washing, and that's something that I talked about before, and I'm sure I'll talk about again in different places. One of the best ways to prevent the spread of colds and flus is hand washing. You know, we go through our day, we touch so many things. You touch doorknobs, elevator on the way up
Oh
here,
yeah, you
right?
did. And the elevator's big.
Yeah, well, because so many people
Yeah.
go through there, and you don't know what was on the hand of the person that touched that surface previously,
Yeah.
right? And then being aware of not touching your nose and your eyes. I think it's typical for people. You have a little itch and you just kind of rub, and that's often how we get ourselves sick. And then once we're sick, we pass it on to other people. So hand washing. If you are sick, maybe if you feel that you could be coughing, maybe wearing a mask, not to prevent you from breathing something in. They don't generally do that, but to prevent you, if you cough or breathe out, to prevent sort of a little bit of spray from what you're breathing out. It'll hopefully hit the inside of the mask, and doesn't sound nice. It sounds a little gross, but you could be doing a little bit to prevent making other people sick and passing it on to other people. And certainly if you're able to, depending on what you have to do in your life, staying home when you are sick and isolating a little bit is always worthwhile.
Yep.
Yeah.
And make sure you're getting sleep.
Yeah.
I think people really, and we were just talking offline, and we were like, we're going into daylight savings, and then we're like, no, the clock is turning back.
Yeah.
Like, it is crazy, but that little hour difference has a ripple effect even on some people's sleep and their rhythm. So just right there, next week you could be off to a bad start, just, changing your routine, your sleep routine. You're not getting that 7 hours, now you're only getting the 6 hours maybe, just because it's mixed up. But I would say sleep is so important.
Every time the clocks change, for some people it does cause a problem. I mean, it can take a week or so for people to adjust. It's almost like staying at home and having a touch of jet lag, even though you're not getting to go anywhere exciting.
Fun.
Yeah. So sleep is important. It's easier said than done for some people, but everything you do, from sleep to good nutrition, there's a lot of evidence now about gut health being important for the function of your immune system. And I mean, I'm a big believer in getting your vaccine, and everyone's entitled to their own opinion on that. I'm not going to debate on anyone on their opinion if they have a strong opinion, but there's such a long history now of minimizing diseases in our world, or nearly eliminating diseases due to vaccines that have had serious consequences on people prior to them. And so we have a history of this, and although the flu vaccine, because flu viruses mutate so much, you can't eliminate the disease, but you can reduce the load on people, on society, with vaccines like that. So getting your vaccine is important, not just for you, but minimizing the spread to
the risk for others.
The risk for others. So the people who are highest risk are going to be very young kids and infants, going to be the elderly, or people who autoimmune diseases, cancer, people who might have respiratory diseases like COPD and asthma, even heart conditions, and diabetes do put people at higher risk for complications due to respiratory illness like flu and cold.
When you start to say all those things, when you're like, oh, it's just the young kids and the elders, but when you start to think autoimmune disease, all these in your circle, you probably have a handful of those kind of people that are.
Absolutely. It would be very out of the ordinary for everyone not to have some people like that in their circle. I mean, it's estimated nationally, and everyone's not tested for influenza, but it's estimated nationally that over 12,000 people are hospitalized just due to the flu every year in Canada. And roughly 3,500 deaths due to the complications due to the flu. So that's a fair number of people, and so widespread vaccination could reduce that.
Yeah, very important.
Yeah.
Okay, so if people are watching and they're like, oh gosh, I haven't had my flu shot yet, but I need to get in, what's the easiest way to book in, or how do they come see you? I think we can walk in. I think you can book online.
Yeah, every place is going to be different.
Yeah.
And that's understandable, due to your ability to have adequate staffing levels. Some places just can't handle the extra load of walk-ins for vaccinations if you don't have the people. For booking, so some pharmacies will have their own booking sites. The problem is the government has, if you go to Get Vaccinated, or just basically Google Get Vaccinated, I think the site is something like getvaccinated.ca, but you can book an appointment at any pharmacy. You can just search based on town or postal code for your area and book an appointment. Now, it's possible that all the booking slots are filled. That definitely does happen. So for us, we do handle walk-ins.
Mm-hmm.
We have the staffing usually. You could come in and have a whole busload of people come in at once, and we're going, it's going to be a longer wait than expected. But generally, we're pretty good at handling walk-ins at Rutland Medical Pharmacy. So we'll do our best, assuming the supply is good, to fit people in. You can book appointments through the Get Vaccinated site, so there's both options. And I know there's other pharmacies out there that will do walk-ins too. So if navigating the booking site is a challenge for you, which it is for some people, or you just don't see something available, if you have a trusted pharmacy, check with them. They might be able to do a walk-in, and if not, there's probably another option around where you can certainly find it. Most doctors' offices don't do it anymore. There might be a few. So again, I don't want to speak for all of them, but it's not really something that the doctors are doing. I think their time is more valuable spent doing other things in general.
Yeah, but it's kind of cool, like how we started in one of our first episodes, like teaching all the things that pharmacies can actually help you with. So it's kind of full circle, where it's like you can lean on your pharmacists more, and ask questions and help with medication and vaccination. So it is cool that the pharmacy is doing more, and it's part of your team, right? Your health team.
It is. So we want to be just a member of the overall, holistic healthcare team, including could be nurses, could be doctors, could be naturopath, pharmacist, physio, chiropractor. Everyone's part of the healthcare team, and my belief is we should be there to work together for you as an individual. That's how we can be successful kind of in our communities and for people, is to improve your health by working together.
Yeah, amazing. I don't know about you, but during this episode too, I've been thinking about all the things I've touched today. Like you just, when you were going through wash your hands, I was like, oh my God, I need, like, not that I haven't washed my hands today, but I want to wash them more.
I know.
And it's not to be like germaphobe, but it this time especially, just doing those extra, you let it go water, maybe just an extra wash of your hands.
Keeping some hand sanitizer in the car, because when you touch the gas pump, you can't.
Yeah. But the door handle one really got thought.
For sure.
Yeah.
Yeah, no, I mean, my daughter's 12 now, so it doesn't really work anymore, but we still joke to her when she gets sick that she needs to stop licking doorknobs. And she'll, of course, Dad, but
do that.
But that's one of the worst places in schools and public areas, because how many people touch those sorts of things? And I'm not a germaphobe either.
Yeah.
But I do want to try to avoid getting sick.
Gosh, me too. When we were talking about how long symptoms can take, I am definitely, I don't know, maybe it's the autoimmune endo disease. Like, I'm definitely someone that when I get sick, I'm down for weeks. And like, I go through all the waves of, I swear it's like flu, cold, and then I'm back.
Yeah.
So yeah, you definitely want to take care of yourself. Okay, well, everybody, I think that's a wrap. Go wash your hands. And we hope that, just if you are looking to repeat, if you're looking for vaccinations or any pharmacy questions, or you need a pharmacist, go check out Rutland medical. They are definitely community and customer driven. So yeah, I think just be safe and wash your hands.
Yeah, no, thank you for that. And yeah, absolutely. If there's any questions from anyone in the community, even if you just want to understand vaccines and how they work better, we're always happy to discuss things like that. And certainly no judgment from us, no matter what your belief or background is.
Amazing. Well, thank you. And we'll see you next month for our next episode.